So, ladies and gentlemen, I warmly welcome all of you to today's meeting. We will have a separate part of the translational medicine meeting. First of all, you will get a little introduction about what translational medicine means, because still what we found that many people do not understand the term, what we are using. And of course, there are plenty of variation on translational medicine. The second part, we will show you the results, what we could achieve in the last 3 years at Semmelweis University, and we'll show the opportunities from September 2024, what you can do with Semmelweis University. And this will be followed by actually a panel discussion, and I am more than happy to welcome our panel tonight. So let's introduce everybody here. My name is Peter Hegyi. I have the privilege, I can say, to be the director of Center for Translational Medicine. We have here on board Zsolt Molnár. Welcome, Zsolt, tonight. Zsolt is the group leader of actually the intensive care and cardiology research group. I am also very happy to welcome Gábor Gerber, who is the Dean of Faculty of Medicine and one of the most active research group we have here. I also more than welcome Nando Rácz tonight, who is actually leading the gynecology and the urology research group and providing brilliant addition to the topics. I will show you the data later on. I'm also very welcome András Bánvölgyi, who is one of the group leaders actually of the immunology and dermatology topic. Welcome, András, as well. And I am also very happy to welcome Dezső Csupor, who has been also a key figure in translational medicine in Hungary, started also earlier in Szeged and Pécs University, and after also moved to the Center for Translational Medicine later on. I am also very happy to welcome Szilárd Vancsa, who is the vice director for education at the unit. I would like to start with the introduction of translational medicine, and I would like to ask the members whether my slides are visible.
It's okay.
It's okay. Okay. So thank you. So let's first start about what is about translational medicine, what is the importance and evolution of it. If I would like to summarize with 2 words about translational medicine, I definitely would say that translational medicine actually is from science to society. So the major aim of translational medicine is to translate all scientific knowledge back to the daily application in healthcare. And this is what we are very much committed in our program. So why is it important? You can see that there are plenty of healthcare challenges what we can have during our time. You just recently had experience in COVID-19, but also dementia, diabetes, and plenty of other cancer diseases are coming. And of course, everybody, including doctors, scientists, politicians, individuals would like to see the community solutions. But if any healthcare challenge is coming, the first thing you have to do is scientific activities. But what you need to do science, you need plenty of talented young people and creative ideas. And unfortunately, if you look at the current trend of talented people, how they join to scientific activity, this definitely declining in all over the world. Here is an article from different countries, from different continents, showing that at secondary school level, young people choose their interest outside of life sciences, and the number of students choosing also medical sciences or biomedical research are extremely decreasing. Why is that? Of course, we always can blame the new generation. I remember when I was very young, I was also told that, of course, but in our generation were much different than this one. But I would say that besides, we always try to tell the new generation that they are different. I think we have to look at what we are doing or what we can do. And there is definitely a lack of attractive and relevant educational models for young people in the 21st century. However, discovering new things are not enough. So if we just put our articles to the shelves and nobody take it down from the shelves and not using in a daytime, this will never come to community solutions. So the second very important part is medicine, is clinical and medical sciences. So you need healthcare professionals, including doctors, dietitians, psychologists, and all other professionals to be scientific oriented and make the daily decision based on evidence-based way. However, if we look at the current data from Eurostat, we can say that this is very much insufficient in the 21st century. I can show you a dramatic data from Eurostat, which show that under 75, currently, 1.7 million people dies annually. However, if we used all the scientific results, we would take them from the shelves and all the population would use it, 1.2 million people's lives could have been avoided. And this range is, I think, really, really showing that currently there is a clear insufficiency on translating scientific knowledge for real community benefits. And if you will look at the countries, it's also very clear that usually in Eastern European countries where the scientific activities are not as advanced as in Western Europe, this data is worse than the other countries where the scientific activities or understanding the scientific results. In Western Europe, it's better, but it's still 3 to 4 of 5 deaths really could have been avoided. So why is that? Of course, we can say that we need to be at the patient side and we are actually overworked in medicine, but it's still what we need to think about, to look at the medical curriculum, which in our opinion, it hasn't kept pace with the accelerated scientific activity. Because if we look at the data on published article, it's also very clear that science will never slow down. Science accelerating, and it has been accelerating from the beginning. If you look at how many articles were published in 1950 and how many articles are predicted now in 2024, last year I think it was around 1.9 million, it's very, very clear that the activities in science is over 20 times faster than it was in the past. But if we look at the results, the mortality rates and everything, we cannot see this benefits in the daily practice. So in 20 times slower activity in the last century, it was enough to write textbooks. So we wrote a textbook within 3-4 years, and we could use it for 10 years after the next edition came there. In the 2000 around, guidelines started coming up, which means that experts in the field summarize the current scientific knowledge in the field and put it to the guidelines. So one guidelines is usually 2-3 hours to put together. But based on the activities in 2024, look at in the last 24 years, it's 4 times faster than it was. Nowadays, almost, we don't even have time to wait for the forthcoming guidelines in the field. Healthcare professionals needs to have the knowledge and needs to have the skills and ability to directly translate the most recent publications, the most recent knowledge for patients' benefits. So the vision of the Center for Translational Medicine is that we would like to see all scientific results applied in healthcare. So easily science in healthcare, and our mission is to have a breakthrough change in science education and patient care, not only in Hungary, but we would like to assist it in all over Europe and all over the globe. So for these two parts, so these two insufficiency, we made up actually a big team, including academies, include the European Academy and the National Academy of Scientist Education in Hungary, the Hungarian research networks, and the universities to put together two highly important programs. The first one is actually targeting secondary school students to find more secondary school pupils to choose their career in science or medicine. And the second part is actually from the other side around, for healthcare professionals to teach them, to educate them how to translate the scientific knowledge actually for patients' benefits. Today, of course, we don't have covering all the programs, but we have really time to introduce what's going on in translational medicine. And this program started in 2016 at the University of Pécs, and in the last 8 years, it was continuing developing. So what's the problem actually with the old model? Why the old model is not good? Translational medicine came in the very late phase of the 19th century and in the 20th century. And the major aim was from basic scientists to show everybody that every kind of basic discoveries can be translated for clinical application. But the first model from T0 to T4 separated the persons, the individuals who were working on the model. And recent data suggest that generally, if you put all scientific results to one box and looking at the average age, how many years it's necessary to translate this knowledge for community benefits, it's over 15 years. So this is really slow, especially very slow if you look at the science activities in the 21st century. Therefore, we were thinking what kind of new models can come, and I really feel as a privilege to be a member of Academia of Europea, which is the largest and most prestigious academy in Europe, including around 5,000 members and including 83 Nobel laureates. So we established a translational medicine program in which we developed the model where healthcare professionals can start the scientific activity, summarizing the knowledge and immediately communicating back for patients' benefits. And it was really, really very nice to see that this really accelerated the translational medicine cycle for almost immediate effect in healthcare and the plenty of part, and this was actually published in Nature Medicine. We could see the immediate benefit in patients' care. We have hundreds of examples how the persons involved in our programs immediately could elevate the level of healthcare. For example, early administration of energy for pancreatic patients, early administration of tube feeding decreased the mortality in pancreatitis to 1/3. Even the usage of antibiotics in pancreatitis based on our scientific activity could decrease approximately with 50% immediately at different healthcare units. For example, one of the PhD students, actually an otorhinopharyngologist, joined the team from the Bajcsi Hospital, and actually Katalin Illés and Tamás Horváth showed really brilliantly that in cholesteatoma, which is a benign tumor of the region, which is the best operating mode, mastoid obliteration, and they not only published it in brilliant journals of laryngoscopy, but they started using immediately it at their hospitals, and the recidive of cholesteatoma decreased immediately with 30% at their unit. So I would be able to tell plenty of benefits in plenty of units about it, and I think this is the most important part. However, if I look at universities, the academic output also tremendously elevated. So when we established the Center for Translational Medicine at the University of Pécs, the Institute of Translational Medicine impact factor was around 35, 50. in a year, and now in a last year it elevated around to 600 and 700 applying the methodologies we have been using it. However, in my opinion, the biggest change was in the PhD education format, which actually brought plenty of young healthcare professionals into the system. And if we look at the future of the community, is always depend on the new generation. So we are really, really the most proud about the new educational system we have found out. And the major foundation of this program is about the learning by doing. And the first program we have developed was a PhD training for healthcare professional. So what's new here? I think anybody who has been in a PhD program knows very well that the old way is that we have a PhD supervisor. It's easy to find out here who is the supervisor, and you can find out actually who is the students who tries their best actually to fulfill the job it's required. So if you look at about with these methodologies, to change 4 tires, for example, in a car can kept for around 30 minutes. But if you look at about the different ways how you can change 4 tires in a car, you immediately can realize that there are much faster, much more efficient way to do that if you think about working as a team and using the latest technology and methods. So we decided to change the old model to the new way, and how we changed it. So here is a PhD student, which absolutely necessary to run scientific activities. They have the dedicated time, but they don't have knowledge in methodologies or in the clinics. We have really brilliant clinicians, and this is not only at Semmelweis universities, but almost everywhere in hospitals. They have huge experience, but of course they are overhand with the patient's care. They don't have time. They don't have really understanding on the newest methodologies. So here is where the Center of Translational Medicine come up. We actually established the so-called Ferrari Model when we brought plenty of experts who are really the top in their own field, including biostatisticians, informatics, GDPR experts, who can really accelerate and work together in an organized way to have as quick as like the tire change in a Ferrari car. In the PhD program, we also made changes because usually in many of the countries, the PhD students have at the end of the second year a progress report. In Hungary, it's so-called complex exam and the PhD defense at the end. But we strongly believe that we should have a much more frequent methods to actually help the students to see the progress. So in year 1, we have 4 phases of the PhD, in year 2, 2 phases, and in year 3 and 4, 2 additional phases. When we start the project, in the first 3 months, we just try to find the best questions. So we discuss the topics, so the students are asked to actually develop their PhD topic until November. In the second phase, when we really start the research activity with data collection, after in the third phase, we start with the statistics, with professional biostatisticians, and in phase 4, actually, we already start writing up the article. And in the first 3 phases, of course, we continuously keep class meetings when we teach the students and supervisors how to join to the next phase. Usually in year 2, the students are already working on their first and second articles. And at the end of the second year, every student has actually a first author paper to submit. They can pass this level only if they have 1 article in submission. And of course, in year 3 and 4, they're finalizing actually the PhD, and the first defense is always in a local hospital or institution, and the second defense is actually at the Center for Translational Medicine. What's more, what's new besides actually the core facility, besides the PhD calendar, are the teaching methods. So there are 5 really different topics, different methodologies, how we try to accelerate the scientific activities and education methods. In the 5 methods, we are covering actually 2 major skills. One of them is the hard skills, when we actually teach all the methodologies for the students, which is used in a clinical way. And we also covering the soft skills, actually, which absolutely necessary actually for somebody at healthcare to communicate their scientific knowledge, their scientific understanding for the patient's benefits. So this program actually, as I mentioned, started at the University of Pécs, and if you can see the development, the number of students continuously growing in the system. And in the last 3 years, with 264 students, this program were really efficiently run at Semmelweis University. So before we go the different education format, I can suggest for the new PhD student supervisors and those institutions who would like to join, I would like to show the summary of the last 3 years experience at Semmelweis University. I have to mention that, of course, nothing in the 21st century can go alone without the help, without the network of other peoples. So there is a very important partners of the Semmelweis University Center for Translational Medicine. One of them is the National Academy of Scientist Education, who providing educational materials for the programs. Academy of Europea, as you could see, who had to develop the program and provides also brilliant speakers for good experience for the program. And also the Translational Medicine Foundation, who has been using all the knowledge which have been generated in the last 8 years in translational medicine. So first, what you need, if you would like to have a translational medicine center, everybody can have, if the university are really committed and decides they want to have a center. And I was so pleased to see that at Semmelweis University, especially led by Béla Merkeli and Péter Ferdinandi, actually opened up the possibilities and provided the financial support to establish these whole centers, including all the experts we need to run this center. So this is the so-called the Ferrari team, who can accelerate any students who are in the middle and would like to really accelerate their scientific activity here. We are also very proud that in a very short period of time, 21 countries joined also in this program, either with students or with institutions. And currently, there are 40 different institutions who actually are involved and sending PhD students or having bilateral education model between Semmelweis University and other centers. So how the program look like? Of course, you need protected time to work. Without protected time, you can't do high quality science. You can't do anything, even a hobby sport, without protected time. So one is very important, that those people can join the program who decides that at least for 1 year, they are dedicated in every week 4 days for scientific activities. Of course, besides this, and this is our hybrid program, they can continue the residency with a lower speed, with a lower level. But in year 1, where the most of the educations are running here, they need around 4 days to run this program. Without this, nobody can accelerate. Of course, if you spend this 1 year very effectively, from year 2, there is 1 day is really enough for you to continue your program. So after that, you can concentrate on your regular job and regular medical training. And of course, after you can defend your PhD. As an undergraduate student, of course, you can spend as much as time you want on the program. Very importantly, and this is different in every country, Hungary is in a very good situation, because the Hungarian healthcare regulations allow somebody who is doing medical training, either in gastroenterology, cardiology, or any kind of training, if they do scientific activity as well, and finishing the PhD before the final medical exam in their own specialty, they can reduce the term with 1 year. So it means if you look at year 1 and 2, this is a 1-year activity. So in Hungary, the students are not delaying with their medical specialty exam. So within, for example, 5 years, they can fulfill the residency and they can fulfill the PhD as well. Of course, it's different in some countries. In some countries, you have to come up as a gap year for science and go back. But if I count that within 1 year, you can be really efficient in science, it's still either in a hybrid way or a normal PhD way. This is really, I think, worth doing it. Let's look at this number 5, different education models. One of them is the regular group meeting. Currently, this is only in person, this meeting. This is where around 30-40 people are together, and this is once happening in a week. It's usually 2.5-3 hours. This is a multidisciplinary meeting, biostatisticians, methodology experts, students, supervisors, and those experts who are needed attending, and all students giving English presentations every week. So by the time somebody finishing this program, at least given 50 or 60 English presentation. So not only we are helping in scientific activities, but everybody whose first language, native language is not English, they will definitely will improve. Students are also challenged very much about with critical questions, and all projects are discussed. So at the end of this day, students are developing and also all projects are developing. However, in this meeting, we don't have time to have teaching, but we have time for discussions. And I mentioned at the very beginning that we have really special groups, and Nando Rach is also here, but in the gynecology and urology group, we have the group leaders who are in absolutely top in the fields, and you can see that within the last 3 years, how many students join. And I would like to highlight that the quality of the research is really high. Already 18 articles are published, including journals like in the American Journal of Obstetrics and Gynecology, which is the #1 journal in the field. One article is already published. Currently, there is one article just in the final revision phase, and we just got the information that the 3rd article in IOG is also got a major revision. So these people are really publishing in the top journals. Most of the articles are published in D1 journal. If we go further, the group of gastroenterology, I think, is already accelerating as well. We are also very proud that we are publishing the top 25% of the journal, including one of the publications which were in gastroenterology cover page last year, which is also a very important journal, and we also already have lots of students in it. Pediatrics, this is also one of the success stories of CTM, and you can see about the leaders of the programming, including Miklós Garami, Andrea Párniczky, and András Fogarasi from 3 different institutions. So even you can be a group leader if you are not your full-time job at Semmelweis University. And there will be within, I think, a couple of days, the first JAMA pediatric publication is coming out from this group. Cardiology and ICU, also a top field, and I'm very happy that Zsolt Molnár is also here with us, and they just had really a top article in critical care showing about the usage of procalcitonin as a procalcitonin-guided antibiotic administration, which is, of course, in top field. So not surprisingly, they are also publishing in the top journals. Dentistry, this is one of our flagship, the leading part. They are publishing 2/3 of their articles in the top 10% of the field. And I am so happy that Gábor Gerber is here tonight from the Faculty of Dentistry and providing absolutely lots of students. Currently, almost no medical dentistry training without having PhD students in the field. Of course, there are other groups which are developing, the orthopedics and traumatology that recently started developing. Also, if we go on the dermatology, immunology group with András Bánvölgyi, also the otorhinolaryngology group is developing. Neurology and psychiatry, also a growing group which are started also publishing in really, really good journals with small amount of students. Besides gastroenterology, we already have different diabetes research group, and also pulmonology start growing. So altogether, this kind of group meetings are the basis of the group discussions. Of course, we need classes where we use so-called blended education, when the students in 1 week do e-learning classes. So we have all the kind of e-learnings in video recorded. The students write tests before and after, and they can listen all the presentations, so they can acquire the knowledge. And always the forthcoming week is a practice where they can practice about the troubleshooting in the different fields. Of course, after the group meetings and the class meetings, you need time to go into really to the details in the projects meeting. This is actually so-called projects meetings. Currently, we are running 541 projects. Of course, there are people whose participation is mandatory, the PhD students, the clinical topic supervisors, the science methodology supervisors, and always those people are coming when needed, different experts. We have, of course, lectures. As I said, we have the privilege to have many partners. So even like Nobel laureates, Academy European members, top clinicians in the field are coming to this program to show what is the career option in science and medicine. This is always a celebration of science when they are here. And finally, as I showed you, that there are 8 points of our education, and you can find at our webpage all the projects booked with the 264 students and the 541 projects. And if you go to the QR code in there, you can find all the presentations of the students and all the topics. So everything is fully recorded and transparently available in our net. Of course, the students are also required to progress well. So those who can't progress in the 3 months period or the 6 months period cannot continue the program. They go back to the daily healthcare activities. So 91 students started in 2021 and formed this group. 74 students achieved the complex exam and passed it. So 4 of 5 students are able to accelerate. Of course, this program is only for those who really would like to push the gas pedal at the Ferrari. So the other 20% of the people, really, they are not committed, and the small amount of core facility stuff, it's better if they do their PhD outside of CTM, so we can concentrate our energy mostly those students who are accelerating. There is a change in the PhD thesis as well. The requirement is to have 2 Q1 first authors paper oaths of around 5 impact factors. The first part of the PhD is always actually why the students started and what was the vision and mission of the students when they started their research, and they almost continue their results and finishing the implementation of the research. This is, I showed you at the beginning, that there is a huge gap of translating scientific knowledge for community benefits. We are pleased that this year we already have the first PhD defense by Fanny Mesnerich, whose supervisor was András Bamvölgyi. I would like to highly congratulate. And currently in many universities are seeking also people from the PhD defense. You can see about the audience, there were over 120 people attending, were a really brilliant defense. You can find it also on the net, because as I mentioned, everything is transparently at the CTM webpage, and Fanny finished their PhD with 3 very distinguished first author paper. So this is a summary of the academic field. You can see the journals we could finally reach to publish, which suggests that the methodology part, the core facilities, the amount of work what the students put in, the knowledge in the clinicians are really, really excellent. And looking at currently, we are running 541 projects and 185 articles are already actually published. So I think this training really shows that there is a big gap in clinical science. What if you fulfill with a good educational methods can go. Of course, like in every university, we also try to have really social events, sports event, arts event. So the students who are coming to Semmelweis University, Budapest, can enjoy not only the scientific part, but also the cultural and the real part. Of course, after year one, you can decide whether you immediately going back to healthcare or try to run up in this system and try to be also an ambassador of translational medicine and grow yourself. And as I mentioned, that the speed is really fast. So if somebody like the first year PhD students as a science methodology practitioner who is doing the research, stay in the system and become to be a supervisor, methodology supervisor of the next generation of the students, after advisor or experts can run really, really quickly in the system. I am very proud that tonight also there will be 2 science methodology experts will join who are already get the academic position as an assistant professorship at the university around the age of 30, which is, I think, a good advancement. And also now in this program, those who are joining later can have a competitive salary, so they can get more knowledge. And we know that information can stay inside your mind much longer if you retain your knowledge, and you can retain your knowledge by teaching. The second issue is you accelerate your scientometrics. You can get salaries, academic positions. So I think it's really worth not rushing back to the clinic, but this is everybody's decision. So the environment is also great. As I mentioned, we have the privilege of the National Academy of Scientists Education partnership, who are providing also Nobel laureates to the program. Last December, there were Randy Shackman, Nobel laureate, visiting us and provided to the Semmelweis students the certificate for the best scientific awards. I think those students who were involved never forgot the time when they were actually congratulated by a Nobel laureate. Even more, in the last meeting in March, Semmelweis University also joined the clinical medical schools program with Harvard University. And in last March, actually at Harvard, many of the students could join, more than 50 students from the program could join the Harvard Medical School training program. And I am more than happy to see that our 2 vice directors in the program, Szilárd Vancsi and Rita Nagy, also get the school certificate, and all the other students. So if you look at the environment, it's also very, very stimulating for the students. So Randy Shackman, when left Hungary, he said, actually, I wish there had been opportunities like this when they were young. So the final part, actually to show you how you can join to this program from 2024. And there are 4 distinguished educational formats for postgraduate students, for undergraduate students, for institutions who would like to build up a bilateral program with us, and also those who have not 1 year to join us, just for short training, for 4 weeks or 2 weeks training. We also have certificate programs. Let's look at the most welcomed and the most active program and the oldest program of our postgraduate program. So who can join as a PhD students to the system? Of course, everybody, but what are the conditions? So if you are an EU citizen and you don't have a workplace, you just want to join as a PhD student to Semmelweis University, of course, you need to pass the entry interview, which you need to do it in English. And we would like to understand your background. Because you don't have a workplace, you don't need to bring any kind of certificate from your workplace. What you can get, actually, the Hungarian government scholarship. Of course, there is 90 scholarship provided for this program. So of course, the scholarship can run out if at one stage, but currently this is what we can provide, and you don't need to pay tuition fee because Semmelweis University and the Hungarian government put the money in it. Actually, altogether, Semmelweis University providing 1.5 million, 1.5 million euros for this program. Of course, you can join as a hybrid program, and which means that you are also like an EU citizen, but you have a workplace where you are a resident doctor at your hospital. Of course, you need to fulfill the entry interview, but your workplace needs to sign that they agreed that you are joining up the program, and they understood that you need 4 days to spend it actually in science. So you need to bring actually this kind of certificate. Currently, you also are entitled a stipendium every month, a scholarship from the Hungarian government, and you don't need to pay tuition fee. Of course, if you are not an EU citizen, you also can join to the program. Of course, if you don't have a workplace, you don't need to bring any certificates. The 1-year program fee is 20,000 euros, including everything, including the access, the videos, all the educational training programs, all the scientific leadings, all the statistical works, the video recording. So if I look at the amount, what you got, this actually really a low price concerning other Western or American universities' prices. The major points happening in year 1 and 2. So this is when you are required for the 20,000 euros tuition fee. And later on, this is 10,000 euros for year 3 and 4. It's dependent on when you will finish your PhD. Of course, if you have a workplace, it's exactly the same. So if you are outside, if you are not EU citizen, but you are, for example, workplace in a hospital, and they would like to send it, exactly the same is important for you. Semmelweis University are keen to include the alumni of the university. Therefore, the university provide 50% discount for everybody who graduated at Semmelweis University. I think this is a very generous discount they can provide you. So PhD, you can come with MSc, MA, MD, DMD, PharmD degrees, and you are welcome in the different sources. Of course, if you have questions, you can ask it here in the chat, in the question and answer. We try to answer you at the end of this webinar, but if you have questions, of course, you can send emails for us. Of course, we are thinking on undergraduate programs as well. Of course, if you are not a student at Semmelweis University, you still can join as a project student, either of the universities you learn in Hungary. So you can join in either you are an EU student or not. It means that you will join one of the projects. So, and if the projects people will accept you, you can learn scientific methodologies. You can have co-authorship in the papers. So generally in Hungary, we say it TDK, which means the project students, and you can join for free. Usually we can feel that they can be really better PhD students later on if they join as an early age as an undergraduate student. I am very happy to introduce maybe a new thing, which could be new for almost each of you, that you can join now as an official PhD student and the program during the last 2 years of your graduation. So if you are a 4th-year medical student, or actually a 3rd year like pharmacy students or MSc students, so in the last 2 years, you can apply, you can have the same grant like the others in the past. So if you are in a Hungarian education covered by the government and you don't need to pay tuition fees, and you are coming from the Semmelweis University and you are EU students, you can join and you will get the 140,000 scholarship. And those who are Hungarians and included and finally most probably will do their job as a medical healthcare professional in Hungary, the Semmelweis University and the government will cover your tuition fee as they cover in a later phase in the PhD program. For those who are entitled for the scholarship, but they are not in the Hungarian government-sponsored educational method. They also need to pay, but less 10,000 euros per year. But you can see that this is around like 400 euros, 350 euros. That from this 10,000 euros you can back approximately like 4,500 or 5,000. So if you look at how much you pay in and how much you get, it's really a small amount of money. And if you coming and you have an accommodation, a rental fee here, you don't need actually to spend more money on your education. So I can highly suggest it. Of course, if you are a non-EU citizen, you are still very welcome. And we have plenty of like stipendium Hungaricum students as well. But in that case, you of course need to cover your tuition fee. And here, as I mentioned, in some cases, we can provide the Stipendium Hungaricum grant. You can have a look of their webpage, but you will not get scholarship from actually Hungary. Okay, so after the undergraduate students, as Peter Ferdinandi mentioned before this webinar about the bilateral programs, we really are keen to establish bilateral programs. We would like to see to grow the translational medicine. So we are very happy to transfer our knowledge to other universities as well in a bilateral ways. So concerning the bilateral program, of course, institutional agreement is needed. So the two institutions needs to agree that we will work together on the program. So a memorandum of understanding is needed. But how it looks like? The students coming and joining to both universities, so they will be PhD students also in another university, and that also Semmelweis University. We have really good examples from a couple of universities I will show you later. And the students have benefits to have like scholarship from the two universities. All articles are really published together. So the corresponding authorship, everything publishing jointly. So both universities can have the affiliation there. The corresponding authorship is shared. But of course, the cost also needs to be shared because as you could see, this kind of system currently running at Semmelweis University. So as I mentioned, the Semmelweis University is spending 1.5 million euros annually. The partner universities do not need to have any involvement of this. So the core facility is still Semmelweis University will run. So you don't need to contribute to that. However, after every student, you need to contribute. As I mentioned, the approximate cost for one student is around this 20,000 euros. So if you would like to have your also PhD students to get the full education here, the full service of statisticians and everything, in year one, you are asked to provide 10,000 euros covering the half of the education. Year two is much less, year three, year four. So within 4 years, it's 15,000 euros. But look at these numbers. Like, for example, if the students are coming from the EU and the students are entitled to receive the EU fund, even from this money, we are giving this 20,000 back to the students. So even Semmelweis University will pay back more. We are very happy to show that there are already 3 universities where actually students are already were in the program in this 261 students. We have from Iași and Bucharest a good team, and also from the Martin University from Bratislava as well. And we are still started discussing it. I was also very happy to see in the tonight webinar Radika, who is coming from Târgu and we already had the agreement with KU Leuven, and more universities are joining. So if you are there as a university leader, just please contact us. We are very happy to discuss what you need and how to put our efforts together. Not only this, because Semmelweis University, we could actually discuss with MOL Foundation a really excellent program. This is actually running from the neighborhood in Hungary, Romania, Czech Republic, and Slovakia. And we already have many students from Romania who joined this program. So if we have a bilateral agreement between the two universities from Romania, Czech Republic, or Slovakia, not only we can have the common articles, but after each students which are covered by the partner universities, this foundation cover the second students for completely free. So it means that like a 50% even reduction, the covering. So if you have one very good student and you have one more for two students, we only need to pay for the price of one student. I think it's an unbelievable good opportunity. Currently, the MOM Foundation put 150,000 euros, which means 10 student support. So until this money is existed, you can apply. So if you make an agreement with your university and you have two students for this program, you can have one more sponsored students, and the other sponsors needs to provide it actually by you. Of course, if you are coming from outside of the European Union, we still are very happy to negotiate with you. Of course, in that case, we need the supports from the partner university, the 20,000 euros in the first 2 years and the 10,000 years later. And of course, in that case, because by the Hungarian government system, they are not providing currently scholarship, then we will not be able to provide you, but we can collaborate, we can write the articles together, so your affiliation will be there. The PhD can be granted bilaterally. We are also very happy to show that this is not only just a dream, but we have the Translational Euro-Asian Net by the Chinese University of Hong Kong, who is in the top 50 universities, included the Shenzhen Institute of Advanced Technology. They already joined, and there will be many, many collaborative projects with them. These were the three, but of course, if you don't have such 1 year in your life, but you have like 4 weeks or 2 weeks, and you would like to get a real taste of translational medicine, we have certificate programs in the summer, and of course, we have a winter edition period as well. So we have a basic program, which actually is for 2 weeks, and anybody almost can join who has a good English communication level. This is a very structured program for each day, and we are offering it in person and in online. And you can see here the deadlines, when you can apply, when you need to pay the course fees and the others. And if you look at the fees, they are also really not high. So if you would like to join as a group, even per person, you can have reduction from the prices, and you can have the full 2 weeks programs. If your group would like to have it online, you can get 20% off from the price. And of course, however, if you say that, okay, this period is completely not good for you, you want the Center for Translational Medicine to have it outside of this period, we are also happy to organize it for you. But of course, we need to relocate the resources, need new persons. So this would be a 20% addition. We have the advanced program, which is like 4 weeks, which is much more comprehensive program, and also provide you the certificate. Here you can find in our webpage, I don't want to go into the details again. Here you can see the dates. The same things applying concerning the discount and the more prices. However, very uniquely from September, we will start an expert program. The National Academy of Scientist Education developed a huge materials with over 13 chapters, 190 lectures, over 2,250 slides, with 13 practice days, a huge expert program. Currently, we are designing about the tuition fees and the in-person and online course, but we will come up with more details. And even this year, we also decided to put this 1-year program for an MSc program as well. It hasn't been started yet, and definitely will not start it from September, because we need to accredit it. This is especially for students where they would like to have 1 gap year, especially like from the US, from Singapore, from anywhere in the world, when after their medical education or BSc or BA degree, they just would like to have a gap year. At the end of the year, they will learn the clinical methodologies. They will learn actually the soft skills we show you before. They will actually learn the different article management. They will have 1 first author paper plus an MSc degree. I think this will be also a very valuable program. So finally, this is like from science to society. We hope that more and more healthcare professionals can join, and I really would like to advise to every universities to start such a program. You can have the same success in the program like this. So thank you very much for all of your attention. I think looking at this program, I look at it every year. It's tremendously developing, and I am very happy that now we have many partners also here who have been working for the success of this. And before we start answering the questions and going further, I just would like to ask a couple of comments from you guys who are here in the panel, who have been in the program. And for example, one of the oldest member of the program is at Translational Medicine is Zsolt Molnár. Zsolt, you joined to the program from the very beginning. I don't know whether your current conditions maybe a short message, what this program brings to you as a supervisor and a healthcare professional to hear.
Well, thanks, Peter. Well, I do apologize for my voice. That is basically gone. So I'm very happy to hand it over to others. I'm sorry. But just one sentence, that the reason why I stayed in Hungary in 2019 was this program.
Yeah. Thank you very much, Zsolt, and we wish you a good recovery about your voice. And now the other one, actually, Dezső Csupor, who also joined from the very beginning in this journey, and what this brought to you. You were a basic scientist as well. As I started my career as well, you published several highly important papers. So, and after joining to this, so what a basic scientist, for example, can get from this program?
I was always looking for to do something which is useful for the society, and when I was introduced to translational medical approach of science, it was a big surprise for me, because it was quite clear that this approach can be combined what I was doing before as a basic scientist. And now I have very good experience. And just to give you an example, I'm currently working on the development of an official therapeutic guideline, the backbone of which is 2 meta-analyses that I have done with my PhD students in the CTM. So the knowledge generated here is useful in the practice, and this is very motivating for all us who are working in this team. And it is very motivating also for the students. So what we are doing has direct impact on the practice, and it is very important.
Thank you very much, Dezső. And now we would move Gabor as well. To be honest, as I always referred, one of my biggest surprise was actually the program is the unbelievable enthusiasm of the Faculty of Dentistry in this program. So your team has started when the program was in Pécs already slightly, but after when it's moved to Budapest, it was actually just astonishing for me how you joined. And of course, as a dean of the Faculty of Dentistry, you had an unbelievable involvement, and how you can in fact enthusiase your whole faculty. So what this program brought to the Faculty of Dentistry, and what do you think about this program?
Thank you very much, Peter. It's really a great pleasure to be a part of this program. And as we all know, dentistry is a cerebral-manual subject. So people are dealing with treating patients already in the dental training program, not so much on the basic science. So they have first 2 years involvement in basic science, but not as deeply because they are already focusing on the clinical studies. However, to get into clinical studies, you need this very effective methodology, what you provided us, and all those helps. So as we have noticed, our young colleagues get really excited when they see a clear vision, a clear method, and a clear prospect. And that helped us a lot because there are lots of data in the dental field as well, which we actually don't use. And this program helped really very much with this method analysis to get into a specific program and realize where are the gaps. And now our young colleagues are developing also databases and new clinical studies on the basis of this program. So actually, not only the young ones, but also the ones who were more advanced and trying to do clinical research, but lacked the efficiency of this clinical research, they get a lot of help as well. So both the mentors, the teachers, and the mentees, the students, had a good, a very good support, and no wonder that the enthusiasm also increased in all of my colleagues practically. So thank you very much. This really speeded up, as we have seen with the D1 publications and Q1 publications, the faculties getting higher in the rankings as well. Thank you very much.
Gabor, thank you very much. Actually, your faculty is one of the biggest achievement of the center we could show, and is a very good example that how far a university or a faculty can go with this program. So thank you very much again. I also would like to ask András Bamvölgyi, who you are the one who had the very first PhD students in the program. So congratulations for them. And I think the immunology and dermatology group is also growing. So what you could see in this program, what you might not seen earlier in PhDs, and as far as I see, in each year you are bringing more and more students to the program. So what motivates you?
First, I'm very happy that I could participate in the program, and I have the first PhD student who can complete it. But what is the best in it to tell you? During my whole career, I had to debate what I would choose, science or the daily clinical practice, because I have to tell you I love them both, and this was the first program when I feel I can combine them and merge them into one thing. So I can do both science, which can be used at the next day. This is one very important thing, and the other thing is I would like to know the answer to many interesting fields in dermatology, and I think so with this program we have the ability with all the young talented people in the group to answer them, and I'm very happy to do that.
Yeah, thank you, András, and I think it's growing really well. So besides the enthusiasm of the supervisors, we have really two very young colleague here who actually joined the program actually at Semmelweis at Pécs University first, and Szilárd, you also came from Romania to join to this program at the beginning. I still remember when you joined with your enthusiasm and your big speed in the program, and within a really short period of time you accelerated very much, and you're now the vice director for education in the program. So thank you very much for staying inside. So what you can see in your last 4 years journey in the program?
Thank you very much, Peter, and thank you very much, of course, for the opportunity, because it was a nice meeting back in 2018 when in the spring period we first met, and actually it was I have to say a very hard decision, because of course, whenever you want to move from one country to the other, that's not an easy decision. Of course, you will leave behind all your colleagues or your connections, and you have to start like a new life, and this has a very big risk. And especially people don't want to take this risk when they would like to start their scientific career. But I have to say that luckily I ended up in a program that is very different from all the other programs that I could find in the field back then, and also since then. Of course, since I joined the program, I was also able to not only participate but actively form the program, to develop it, and I'm very happy to be here at this stage as well. But of course, I also finished my PhD very recently, and because of this program, I'm very proud that and very happy that I could publish several publications. Actually, with the help of this program and with my colleagues, I published more than 50 articles with more than 300 impact factors for my PhD thesis. And this was possible because of this team, because of this program, because of the teaching and the educational program that we have here. So thank you again, and I'm waiting for the questions, actually.
Thank you, Szilárd, and thank you also for staying it. And you also are, I think, a good example. If somebody would like to press the gas pedal in this program, they really can get benefits. And also here, Rita Nagy, I also would like to congratulate to you as well. I remember also when you came from a Hungarian hospital, which is actually a famous hospital, the Heimpál Children's Hospital, one of the biggest children's hospital in Hungary, but we're not located in Pécs at that moment. You came from Budapest, from over 200 kilometers, and at that stage we didn't have as many as video recording online, so you had to move down to Pécs actually to leave your place for a year. And actually you started the program. So what motivated you when you decided you change your life and come to Pécs? And after, when you also had a very successful PhD thesis and you still a resident doctor at Heimpál Hospitals, you became to be assistant professor and also vice director for integrity and retention. So please tell me your experience in the program.
Thank you, Peter, and thank you for your introduction. So yeah, when I joined this PhD training, I already started my residency. So somewhere at the middle, then I moved to Pécs, and basically, if you are asking what motivated me, then I just wanted to do something extra. Besides my clinical tasks and duties. And Andrea Párniczky was basically one of my supervisors then, who convinced me, and it was basically maybe not even a week, then okay, let's bring a decision. And then I decided, okay, let's go to Pécs, which was really a totally unfamiliar city for me, but really I really can enjoy anyone to, or recommend anyone to let's bring this, let's say, spontaneous decision and choose another location and get to new people and also new environment. So altogether, that 1 year that I spent there, it was amazing. Really, I enjoyed it, and I love the city since then. So the reason that I wanted to do something extra, and I think I'm one of the examples who did not rush back to the clinical duties, because then I spent a few years already at the Semmelweis University, and I took a coordination role as well, and also I conducted some additional research. So basically, I didn't rush back after 2 publications. And what I can highlight here, Actually, the others already emphasized this fact, but it's very important for me that it's a teamwork. It's a huge teamwork. So besides the hard skills that you can learn here, I mean the different methodologies, you can also learn a lot of soft skills, and you basically need to learn these soft skills, and therefore you will be able to either being a leader of a team, or you can learn collaborating to others. And I think it's not really common to gain this knowledge either in the university years or either in the clinical wards. So I think if you want to be a team member and really working in a team, I can recommend this training and this whole system here that we have currently. So thank you again.
Thank you really very much, Rita. And I just can highlight that for other universities, I could see here also people from Romania, from Portugal who joined in, that if you start this program within 5 years, you can have your own educators in the program, your own leaders. So currently, of course, we absolutely would not be able to run this program without the young people. As you could see, we have more than 20 really excellent people involved in the education. So Szilárd and Rita, within 5 years, not only had the knowledge, but now they are really the key persons in education. So there is really no secret what we are doing. We are really very happy to share our knowledge with the institutions. So thank you, guys. I just look at the couple of questions we do have. So actually, Nagy Előd Ernő already written from Targu Muresh to us that he thanked very much, but he had to leave. So lately, I still thanks Előd also to join in. We have here Kabai Kristina, and she is asking that she would like to join the program from Szeged, and if possible to do the 4-day scientific work in home office in Szeged. How often they can travel to Budapest? Maybe Szilárd, can you answer this question, that if somebody is coming from the hospital, they can do the online training from their own places, and how often they have to come to Budapest?
Yes, thank you very much, Peter. So actually, if somebody wants to come to the hospital, then from a different city than Budapest, then they have a regular group meeting every week, which is fixed on a given day. And actually, this day is fixed from the beginning of the year. So whenever somebody is joining a program, they will get a full academic calendar, and they will be able to fix their dates. So they have one fixed day for the group meeting. The group meeting is generally 2.5 hours. For some groups, the group meeting is in the morning or in the afternoon, but it's generally fixed. And generally, every second week, we have an in-person workshop, which is after an e-learning period. But the workshop is also in person. So basically, the workshop is 6 hours, so that covers almost a full day. So for that day, the student has to come to Budapest and attend the workshop. In some cases, if really the schedule of the person is not letting them, then they can attend on a different day. So generally, the workshops are on 3 days: Tuesday, Wednesday, Thursday. So basically, it's in person. It's 2 days every week that you have to count, but also the rest of the week for some hours has to be dedicated for your research work. Otherwise, it's very hard to progress.
Yeah, so it means that you don't need to move as a living person to Budapest. So one travel to Budapest 1 week, it's 1 day, and the other 2 days is absolutely good. And you would be more than welcome to join in actually from Szeged. We have here Philip Rosowski's questions, and Philip is asking to join as a PhD student. Where able to look at the projects you can run. I think, and I share for a moment the web page. We have the tm/center.org web page, and actually you can have a look that we have a page for projects books. So anybody is clicking on actually the project book, you can actually download it, and you can see all the 541 studies. But also if you send us actually your interest and the place where you would like to join in, or which projects you are interested in, of course there is also a possibility for that. So send us an email, send us what is your interest, and you definitely can join in. So the next one, I also got an email, but maybe had to leave Louis from Portugal, who is also coming from an institution. Very welcome. He wrote back that he is happy to have the agreement between the two universities. We definitely will try to catch you. So we have an anonymous attitude asking that is Stipendium Hungaricum scholarship applicable to the MD PhD program as well? It's a very good question. I will ask the Stipendium Hungaricum leadership. We had a meeting with the president. Actually, I don't know whether you are Stipendium Hungaricum students or not. If you are already a Stipendium Hungaricum scholarship students, I am not sure that they would twice sponsor you with 2 scholarships, but I definitely will ask. We can put it to our next meeting to look at. But of course, we will ask whether you can apply it for not. Then the other question from the same person is an international student is asking about whether she or he can continue the residency in Hungary. To be honest, I am not very much aware of the medical health regulations in Hungary. But one thing for sure, if you got the degree at Semmelweis University or Page or the others, so you got the degree inside the EU, I think you have a chance to get it. I don't think so that anybody can guarantee this. And of course, there are language barriers and so on. But I know students, international students, who finished Semmelweis University or Page University and started working in Hungary. How, and the same person, how they can get a supervisor, or how does one become a supervisor? Anybody who has a PhD degree can have a supervisor at CTM. Of course, there are rules and regulations you have to keep, but anybody can join as a supervisor. The only requirement is the PhD, speaking English, and keeping the rules and regulations, which mean that you have to follow every week your students. We have another question from Adam Alexandra, who thanked the presentation. And is it possible to join the MD PhD program if fifth-year students? Yes, indeed. Very welcome, Adam Alexandra, in the program. Yes, from last year it was not possible, but from this year, yes. So as a fifth-year medical students, you can join. You can start it from September. So you are finishing your last year in medicine and you start your PhD as a year 1. So you can do year 1, which is the most active. And after, when you start your residency or anything, you will be a year 1 resident doctor and you will be a year 2 PhD student. So of course, you can start it. It's again an MD PhD program, not able to finish 2 papers in 2 years, but have my residency outside Hungary. Is there any way that I can continue the program? Yes. So actually, the only year is year 1, when you have to locate it in at Semmelweis. Only 1 year, which means that after you finishing year 1, from year 2, year 3, year 4, you can do it online. So we have the setup. So if you are, for example, a 5th-year international student, you do year 1 here in person, you go back to your home country, you start your residency, you can follow year 2, year 3 online. That's absolutely sure. Is it compulsory for all Semmelweis University clinics to let their residents do the hybrid program? No, definitely not. hybrid program means that you can do it also with work. So the general issue is the PhD program. You can do a PhD studentship. Hybrid program, you can be anywhere. You can work anywhere, either Semmelweis University, a county hospital like Székesfehérvár, or Heimpál National Institute for Children. Anywhere you can be. The only issue is that your workplace needs to confirm that you got the protected time. Because if I look at the students, I showed in the program that 20% couldn't continue the program. The major reason was the lack of protected time by the institution they were working. I don't know whether if we still can wait for others. Any other questions coming there? Of course, if you would like to join to the panel and ask your question actually in person, this is also a possibility. So don't be shy. I don't know the others, maybe to have any further thoughts. Actually, the program, I really, to be honest, for me, because I didn't say what this program brought to me. I also started as a basic scientist, and the whole idea came from the fact that I really wanted to see the benefits of the data in my patients, as I am a gastroenterologist and pancreatologist. So, and actually developing the program, including this team, of course, unbelievable lot of friendship which came here, which I am very, very thankful. I met plenty of brilliant people, and daily I can see on my patients about that they are healing, they are better, and we are doing something not because we have been doing it for 20 years, but because you know the answers for that. New question, is there a list of PhD supervisors who are already associated with CTM? Brilliant question. You can find them one by one in the project book, but not as a list. We definitely would put together the list, but if somebody sending an email or pre-register in the system and you put your research area, we will send you this information. When exactly on the website can we watch the full video back? We will put it on the first page of the video, and we will also send an email to every participant who were here, and you can really watch the video back. Thank you. Oh, Ling Quinn is here. I mean, oh, Ling, your enthusiasm is just amazing. I think it's almost 2 o'clock or 3 o'clock in the morning in Hong Kong. And thank you for being part and showing a very good example by the brilliant Chinese University of Hong Kong. And we really very committed to build up this program actually with you. And we will visit you very soon. And we last time also enjoyed the hospitality, and I hope to be able. Of course, it's 2 o'clock in the morning. I am not sure whether you can join to the program, to the panel list. If you write it to the chat that yes, you are happy to join, then I would like to Attila to bring it, because I think it would be also a good idea if you tell your experience, because you visited us actually in December, that what you could see here in Budapest, also in Szeged. So dear Ling, if you wish, we are very happy to have you also today. But of course, I can understand if you can't join. Oh, you are here.
Thank you. Hi.
Hi, Ling. I mean, it's amazing. I wouldn't be able to do that at 2 o'clock in the morning.
Yeah, yes, it's okay. I think some of our colleagues here in Hong Kong and in Shenzhen are participating. They still remain behind. Okay, thank you. Very inspiring, really. Thank you.
Thank you very much, Ling, and thank you for your visit in December. Your team, I think 9 or 10 of your colleagues were here, and also your enthusiasm being here tonight, it's just unbelievable. So we're very much looking forward to our visit, and I am I would like to stimulate the European universities, because when we met first with Professor Linquin, who is not only a brilliant orthopedics and inventor, but also running study groups, plenty of, and in Hong Kong. And the other possibility, if you join to this program, that you can have a direct access, this T-Hub I showed you, and there are plenty of opportunities now from Asia, from Hong Kong and Shenzhen. And if you join to this program with bilaterally, I think your chances not only opening up in Budapest or in Europe, but in all global, and all of the challenges in healthcare is global. So
Yeah.
So Ling, it's a pleasure to have you on board.
Yeah, Peter, definitively, and looking forward to your visiting in May here in Hong Kong and China.
Thank you very much, Ling, and good
Thank
night
you.
or good morning.
Bye.
It's difficult to say which one is true for you. Thank you. Thank you, Ling.
Thank you.
So let's look at Adam Alexandra also. She's become okay. Thank you, Alexandra, to be here. And I still don't know who else maybe have any questions or remarks or something. Then I just looking at who else have a question. Anyway, what you can do right now, we are first, thank you for your attendance. We will send you the video link on your email address you provided here for this webinar. We will also send, and I saw that Attila also wrote about where you can see it. If you send an email or register as a pre-register, we immediately will email you, call you up, and try to lead. The deadline for the complete PhD registration is 26th of May. So you still have 6 weeks. If you enjoyed this video, please share with the others as well. I don't know, Attila, whether you can, you still here, I know, if you can switch on your video as well. So we would like to really thank you very much for being an assist here during tonight. So thank you for recording it. And I think finally, I can say that one more question, that what is the current procedure for generating research topics as a first-year PhD student? We love if you're generating research topics, because this is how the new ideas can brought in. So please send your ideas, and we will try to find the relevant supervisors, co-workers for you in the program. Okay, guys, thank you very much for everybody. For the European ones, I wishing good night. For the Asian people, I wishing good morning. People from America and from South America, I wish good afternoon. And see you in Budapest. And see you your email. And thank you for joining us today. Bye, everybody.